Hello, I'm Dr. D, and I want to talk today about recurrent miscarriages and infertility. I often get questions about this. And in a purely Western medicine approach, there are doctors that specialize in this, and sometimes they're still, despite their best efforts, not able to help a woman become pregnant. And so, from an integrative point of view, we look at things a little bit differently. One of the things that we do integratively is look at the ratio or balance of estrogen and progesterone. As a woman, these are the two most important hormones for getting pregnant. They are not your only hormones, but they're most important for getting pregnant. And the ratio or balance between them is a pretty specific balance that we're looking for around day 20 to 21 of your cycle. If you're with an integrative practitioner, they'll look for those ranges on day 20 to 21 in your blood work, not in urine or saliva testing. Most of the research on hormones is done on blood work, not saliva testing. And saliva testing, although I see it used a lot, is highly variant. Research shows that a saliva test can vary by as much as 300% based on what you've eaten or drunk in the last hour, whether or not you're dehydrated, and depending on what other supplements that you're taking. And not only that, most of the research is done on blood work. So I don't personally like to utilize saliva testing or urine testing. I just don't feel that it's as accurate and that we get as good results, not for fertility at least. There's some instances when we might use that form of hormone testing, but not in fertility issues. The other thing with fertility is the other part of the endocrine system. So thyroid, adrenals, the other hormones, human growth hormone, what's going on with these things? Is there another problem in the endocrine system? Other issues that I see for women that are having difficulty getting pregnant is problems with either environmental toxins, that would be like plastics, mercury, aluminum, cadmium. So that's heavy metals, or plastics, flame retardants, genetically modified organisms. So some people are poor detoxifiers and can't remove the toxins that we all get exposed to. And that toxic burden can create a situation that can cause problems with your hormones or with difficulty getting pregnant. Another thing that I often see is probably one of the most common issues with fertility problems is chronic infections, especially chronic infections in the microbiome like mold colonization or chronic Lyme. These types of chronic infections are difficult to find. The practitioner has to be looking for the right thing in order to find them. But if they're there, those will often keep us from making progress. Those are the biggest things that I see, and probably 95% of people that are struggling are going to fall into one of these categories, either a hormone imbalance, day 20 to 21 of your cycle, or some other endocrine problem, an environmental toxicity issue, or a chronic infection issue. If you're looking for those three, that will help you along with your other practitioners to find what might be going on here. I hope this helps.